State University session on childhood lead poisoning in Indiana with special emphasis on Delaware County and Muncie. It's rather ironic for me to invite you to your university. I'm actually an IU grad where the basketball and football are horrible, but they have good degrees in public policy, of which I have one. I'm an assistant commissioner at the Indiana State Department of Health. What we do there is deliver programs that try to improve the health of all the folks throughout Indiana. It's a really exciting job. It has a lot of different levels of responsibilities, some of them more fun than others. One of our keystone projects has been with Ball State University and Dr. Kevin Tricott in the childhood lead poisoning. It's not often, to be honest about it, that you have a project that has so much potential, comes to some kind of fruition with incredible research that is very groundbreaking, and this is the really unique part, that the university, Kevin most specifically, really wants to take this academic research and turn it into positive changes for our kids. And that's the really neat part today, and that's what we're going to be working on. Kevin and Ed Lutz from the State Department of Health are going to present some of the data that demonstrates what we have found after testing over 100,000 children throughout Indiana for childhood lead poisoning. After their presentation, we have a panel of community leaders, and these folks are going to tell you what the data means to them, how they react to it, and how they think they can use this data to improve children's lives. So I'm excited to see as many people here. I hope we have time for questions because it is a small, intimate group. First, I'd like to turn it over to Kevin and Ed to present the data.
Hello, I'm Ed Lutz. I'm the Geographic Information System Coordinator at the Indiana State Department of Health, and I am going to start off the discussion today by presenting the data that we've been sort of working on for the last few years regarding the lead program, and then at the end of the session, my part of the session, we're going to show you some of the new slides that we've been working with in terms of the birth data on other indicators besides lead, such as infant mortality, no prenatal care, low gestational ages, smoking moms, that sort of thing, because I think lead is one indicator, but there are lots of others that are out there that are plaguing our communities, and I think that they all fit into a pattern. I think some of the things you'll see show that those patterns get replicated with the other indicators beyond just the lead. I do want to apologize a little bit because we're going to have to speed this up a bit. Normally this presentation takes about an hour, to be honest about it, and so we're going to have to run it down to about 10 minutes here. So Kevin will be going through the slides fairly quickly, and hopefully if you have any questions we can maybe go into some things afterwards, because I understand we do have some time after the session to maybe go into a little bit more detail if it's necessary. So why don't we get started here. The first slide is just basically a statement of what lead can do and some of the background regarding lead poisoning can cause disabilities, behavioral problems, particularly susceptible are children between 12 and 36 months of age. And so, okay, picture of a child playing in an old house or rundown, something's being remodeled, whatever, and this may be a methodology for a child getting lead into their bloodstream. Okay, Kevin? Okay, one of the first things we sort of started looking at when they gave us the data was, do we need universal screening? Do we need targeted screening? What will the data show us when they gave us the database and asked us to go through this? And so what we did was we looked at children age 6 and under for a period from 1990 through mid-January of 1998. There were 160,000, almost 161,000 records statewide, and we were able to address match 74% of those. Again, mostly in the urban areas where the match rates were in the 80 to 95% range. And these are the general counts that we found in the percentages of the plus 10 and plus 20. percentage rates. And actually those are a little overstated because the 25% that we were not able to address match were not counted in there. And so if you go into those, it would probably lower them a little bit. But we do feel fairly confident about the numbers that we have gotten. Okay, Kevin? Okay, this is sort of a little slide on random or clustered or dispersed, scattered. And you'll be able to see very quickly when we start pulling the things up. This is what we found in Lake County. The green dots are ones that tested less than 10 micrograms per deciliter. The blue are 10, greater than 10. And the red dots, and I think it may be a little bit hard to see here in the light, right in the center of most of the blues, are the ones that are 20 micrograms per deciliter and above. Okay? Right. The ones we see the most of right now are 10 to 20, and of course, obviously, the higher you go, the worse the situation. Okay. This is Mishawaka, South Bend area, and you can see again the clustering of the points in the central city areas. In what we found were the older housing stock for the most part. Okay, next. Goshen, South Bend again, or Elkhart and Goshen. This is Allen County and Fort Wayne and Muncie. Okay, Evansville, and again you can see the clustering of the plus 10s and the plus 20s in the central city area. Indianapolis, again, the clustering in the downtown areas particularly. So what we did was, from looking at the individual data, we found that 80% of our problem was in about 6 major counties. And so we began to look and see what kinds of factors were related to the lead problems. And we went back and did regression analysis on all of the kids that we had in the counties, and we found that of the major factors involved in trying to identify for a predictive model, where the percent of pre-1950 housing is by far the major indicator for a possible high lead location, percent of black population, and then sort of a tripartite poverty scale that's obtained by summing the percentage of female-headed families with children, the percentage of renter-occupied housing, and the percentage of children under age 5 in poverty, again divided by 3 and adding them all together. And then from that, go ahead. You can see from these slides, this whole series of slides, the correlation in those same areas where you find those major factors. Why don't you just go ahead and run through the other cities as well. Yeah. It's pre-50 housing. In the scale, the whole purpose of that exercise was to come up with some sort of predictive model to try and determine if we can locate those areas where lead might be a problem. And so what we ended up with was dividing the state, all the 450 block groups in the state of Indiana, into 8 individual classes. And in this particular model, you see that we've highlighted classes 5, 6, 7, and 8. And as a matter of fact, our state lead advisory committee has recommended, after looking at this evidence, that all kids living in what we consider the class 5 block groups be universally tested for elevated lead levels. So what we came out of all the data was a predictive regression model that we can apply to any community within the state of Indiana. And what you're seeing is one of the tools for one of the communities here in the state. Okay. And hopefully it becomes a tool that local officials can use to help screen for and use in abatement efforts throughout Indiana. And as part of that tool, we can show in the next series of slides we can go right down to the community level. We can overlay a grid pattern on it and then go down, go to the next slide. And we've developed a particular hexagon which gives us all kinds of information about the individual child and the testing that was done at that location. For instance, in this particular hexagon that was done at 3201 some street in the state of Indiana, there were 2 kids tested, and both of the test results were from 0 to 9. If it had been in the 10 to 14 or 15 to 19 range, the outline of the hexagon would have turned to red. So when we show them up on the screen, you can see very easily over here on the right-hand side the kids with elevated blood lead levels in that neighborhood. And when you look at them on a computer screen of various neighborhoods, it really is very dramatic how certain intersections or certain streets just tend to light up. And here's the application into the Muncie area. Once we did the regression model, the next steps were to try and develop some sort of density diagram to see whether or not how we could display this in a way that we would try and protect the confidentiality of the individual, because we can't display it to the public with the dot patterns of the locations of the individuals. So we're working on some density models that hopefully we'll be able to put out there on our internet site from the State Department of Health that shows where the locations are within the community. Okay, and this is this the lead, or this is the? Okay, this is one of the indicators that I talked about earlier, going beyond the lead to looking at the number of maternal smokers on our birth files from 1993 to 1995. And what you see here are the locations of where we found the rates to be twice or more the statewide level, so that you can see a particular pattern there across Interstate 70 and Highway 40. And this is Indianapolis, where the amount and number of maternal smokers are extremely high. And this is the density of the lead individuals in Marion County. And again, you can see on that near east side, once you back up, right, and then click again to the lead, that near east side neighborhood shows up for both maternal smoking and for lead. And what we're seeing, and again, all these indicators are that these same locations tend to pop up. This is low birth weight babies. Okay. Again, you have that teen births, low birth weight. And so we can really identify the neighborhoods that are involved with this. Okay. No prenatal care or third trimester prenatal care. And again, that near east side neighborhood in Indianapolis shows up again, as well as the one on the near north side as well. And we are going through these sort of county by county at this point. We've done the lead statewide, but we've done Marion County, we're doing Lake County right now. We'll just sort of be ticking off the counties and going down the list with those on the birth files. And then shortly coming up, we'll start working on the same kind of activities for cancer and deaths, so we can see if we can locate any kind of clusters or abnormal locations of particular types of cancers or particular types of death. Okay. In addition, once we have the individual indicators put together, we're merging them all into an overall situation. So that in effect, you see, this is the worst of the worst of the worst locations. And again, you will see that near east side and that north side area in Marion County showing up for all of the particular indicators. But this is the kind of activities we're doing. And again, lead is one of the ones that is the one we actually started with. And it sort of was the guinea pig application, and that we found that the things we did with lead can be replicated in other program areas. And we're sort of going on to step B C and D now because of the information we learned from the lead project. But what you're finding is that it's the same neighborhoods all over the state in your communities. And whatever the indicator is, you can pick one and you probably find them there. Now the smoking tends to be a little bit different because it's a little bit more socioeconomically related, and so it will be a slightly different flavor than some of the other indicators that you will find. At least that's what we've seen so far. But that's something that in terms of program interventions and knowing what to do about it is something we need to know. So what we hope to do from all of this is to, again, turn the information over to the local health officials, to local individuals that are interested in these problems, and see if they can then develop interventions in those areas that they feel or we seem to see where problems are located. And then that's what I'm sort of doing here. I'm showing you what we found in terms of the data, and now I'll turn it over to the panel members, and they can talk about the problems and what they may want to do about them or different approaches. Okay?
Thank you. I'd just like to add a footnote that this research is award-winning. It has received recognition in international and national GIS for GIS accomplishments. It received an award for the most innovative use of data from a state agency, which is, if any of you have worked with state agencies, you know that that means a lot. It has been demonstrated and shared at academic and medical and public health conferences across the country. Again, it is an awesome piece of research. But we're here today to try to elicit some community discussion on where should we go with this. I mean, data is great, awards are wonderful, but how can we improve the lives of our kids? So we have some community members today. I'm going to ask each one of them again to introduce themselves and just react to the data and throw out some ideas for discussion on maybe what this community could do together to use this data and improve lives. I'd like to start with Bob.
Well, good afternoon. My name is Bob Jones. I'm with the Delaware County Health Department here in Muncie. And I really want to thank Kevin and the State Department of Health for the good research they've done on this issue of lead. Lead obviously has been around for millions of years. It's probably going to be around for millions more. But how we address this as far as protecting the lives, particularly for our youngsters of our population, preschool population. We have here in Muncie, as you have in many of the older cities here in the state of Indiana, you have a lot of older housing stock built prior to 1950, 1960, if you will, back at the turn of the century. Many of these houses do have leaded paint present in these houses. You have young families living in many of these houses, and sometimes an older house is turned into a multi-apartment building, and you may have a multitude of families living there. Many times you're looking at a poverty situation, and you have the environment set up with the atmosphere and the environment of the house that's not conducive for the health of the youngsters in that family. So how do we address that as a society? How do we address that as a public health department? We have been involved with the hospital and with the WIC program, which is the Women, Infants, and Children's program, as far as doing screening activities in conjunction, of course, with the State Department of Health. And we've been able to identify a lot of these factors as far as we do find where we find elevated leads. With that information, then we can do determinations in the house to find where the lead is present in the house. We have machinery within our department where we are able to do this. So we use that information to provide education to the family, to the landlord of the apartment building, if you will, as far as what we can do to minimize the risk to the children in that particular house or apartment building. The problem I see it is you can identify that and do the screening and you can take those activities, but many times you're dealing with a house that has numerous problems within the structure. In addition to lead being present, you have heating problems, you have the windows are broken in many cases, the roof may have deteriorated, and you talk about lead abatement in that particular building, the cost of doing that may be more than what the value of the particular house or the apartment building is. So we really have to look to the state and probably on to the federal level as far as funding that could help provide the opportunity for many of these homeowners and landlords to address the issue of abatement rather than a temporary approach of just trying to encapsulate the leaded paint.
I said I wasn't going to say anything, but I am Linda Keys, and I'm an associate professor in the Department of Urban Planning at Ball State University and the associate director of academic research and sponsored programs. Today I hope to bring you a little closer to Delaware County to tell you how massive the issues are. When you talk about housing units, when we talk about so many percent of them having issues of lead in the structure. Currently, we have approximately 48,000 structures in the city, within the Delaware County. If you would think about that in terms of saying that 36% of them were built before 1950, and you have 55% if you take it all the way to 1970. And you look at the research that says that there's a great possibility that a unit that was built before 1970 will have some lead, might have some lead on the exterior, mostly, but some interior in terms of the window sills and the woodwork inside the unit. You see what issues we might incur, and that's just the physical side of the issue. If you look at the human dynamics and look at it in terms of what that means for people within these structures, most of the people that live in the housing units that would have possibility of having lead-based paint of some kind used in it are poor, are minority, or they are living with a multitude of issues, the disabled, etc. And so when you begin to tell someone that you or that person could suffer from lead poisoning, that really does not hit high on their list of other things they might be dealing with at the time. And so it's not an issue when you look at these neighborhoods where they are crime infested and have other dynamics that are more pressing on a daily basis. You begin to realize that why this issue has not become as important as it should be in the daily lives of the residents who live in these units.
Good afternoon. My name is Dick Sherry. I'm the Center Township trustee here in Delaware County, which is the better part of Muncie, Indiana, and a little outside of it. As I sat here today on this panel, it's with a perspective that the major role of the trustee's office, especially in a city the size of Muncie, is to meet the needs of the poor. And as I had the benefit of witnessing the full presentation, which you only had 10 minutes of, became quite convicted that the population that's being depicted here is my client. It's the client of the township trustee. We pay rent payments, we buy food, we take care of medical needs. And while that is an important role of the office, it stops short of really accomplishing the total responsibility, which is, getting beyond just meeting the need of the moment. And so my hope is to participate in conjunction with the others here in this community to see if we can't be about the business of enacting change, coming up with solutions, finding the answers to what do we do now that we have all this information, as our monitor presented early on. I think that our office, because we do pay rent payments, we do have some direct relationship with landlords. And to that end, we can bring a little influence on getting changes made in homes if it needs be. One of the points that had already been made is that if we identify a home that has a lead problem and we end up displacing someone, where do they go? And to that end, this office, the trustee's office, has a responsibility of providing shelter. So with that thought, not only enacting change here in our community in Muncie, Indiana, where we live, but it's also to embrace a vision that maybe Muncie can become a model for the rest of the state to look at and say, hey, they did it this way. Let's see if we can't pick up the ball and run with it in the other communities. As we can see already, there's many of them are pretty pathetic shape, just like we have areas in Muncie. So that's my participation today.
Hi, I'm Molly Flotter. I'm Executive Director of Teamwork for Quality Living, which is a grassroots community group that was formed about 4 years ago when a group of concerned citizens felt that perhaps developing themselves into a structure which could address community issues in a different way might be a way in which we could enhance our community. We feel that we're united to improve the health of the community, and that health has a lot more to do with not only physical health, but the quality of life for the people of our entire county. The first thing we did as a group was to look at what is our vision for the kind of community we would like to have in the future. And our very diverse membership, which ranges from Dr. Worthen, the former president of this university, to people on public assistance. This vision we found was the same vision for all these folks. Everybody wanted a safe, healthy environment, a place where kids could grow up with the best opportunities. And so as I learned about this data and was able to see the data, I realized that this was one of the gaps which our group has talked about so often, a barrier that's keeping us from having the very best possible community that we could have. And that's utopia. It's not going to ever be perfect, but there's certainly things that we can do as citizens to address issues like this. We have about 85 very active volunteers and about another 150 that are active sort of in and out of different projects. But the thing that they are able to do is to bring their talent, their energy, and their perspective to issues like this. And I'm hoping that in the future, as Bob Jones from the Health Department and others begin to put together some plans for how to address this, that we can tap into that energy and perspective and use some of those individual citizens to share with us what they know about our community and how they know we can best reach people with this message and do something to begin to chip away at the issue that exists. So while I'm very disturbed by the findings, I'm very excited to know that perhaps the organization that I work with and the many tremendous volunteers who do care so much about this community can play a role in helping to begin to address the issue.
Hi, I'm Jeff Turner. I work for the State Department of Health. I'm one of their licensed lead inspectors in the Childhood Lead Poisoning Prevention Program. My focus is dealing with children who are less than 6 years of age. One of the things I do in my job is to travel around to the northern third of Indiana, assisting the local health departments in investigating the homes of children that they do find with lead poisoning, and looking at the home itself to decide where the hazards are coming from, where the child is getting into the lead. One of the things, these maps have helped my job tremendously, because I can talk to people and tell them what neighborhoods I'm discussing, or give them data and numbers and graphs and charts. But once they see it actually on a map, it makes it a lot easier for them to say, oh, I know that neighborhood. That's over, where my mom lives, or something like that. So the maps themselves have made my life a lot easier, because they can show what neighborhoods, and the health departments themselves know which neighborhoods they have the problems in. But to actually see it on a map kind of brings it all into focus for them.
We could make this interactive If there are questions from the audience, that would be wonderful. Yes.
Yeah, well, I know more than I should, I guess. But I have, one thing is, I don't get it. Here's what I don't get. You know what houses have, like, you take the example, years ago in Newcastle, a family was hurt in a fire because there wasn't a fire ladder going down. The door that was off, the kids couldn't get out. And so, the man who owned the building got sued. But you know the building, so you know who owns it. You have no choice. This is what you gotta fix. If you know that that's the problem. There's such information there, don't go on, hello, you have no choice. That's one thing. The other thing is, for example, they know that lead causes the problems with behavior. So if there are neighborhoods that are having behavioral problems, it means that they can ask backwards to start with the child instead of because of the high school or college or one person. So I don't get it. The two things I don't get.
I'll go with it. I'll try. I'll try. We have no choice. When we're talking about a unit that has some lead issues, and you're talking about the difference between taking all of the units out of circulation that have lead in them, you are talking about raising your population of homeless people by 3,000-fold or more. You're talking about a humongous issue. Because if you're just looking at the units that were built who were built before 1970, you're going to take out 56%. Okay. Okay. And take it, there are some things that you can do. But at the same time, when you talk about taking any units out of circulation, when we have fewer units, we although some of us don't believe we have a homeless issue, we do have a homeless issue. If you live with someone, and there's a lot of this going, if you live with someone temporarily till you can find a home, you're homeless. A lot of us consider that just a relative moving in for a little while, but that is a homeless circumstance. And so we don't have enough housing currently. The other issue is invasion. Government has this thing about, if I know you have a child that's got lead poisoning and I know your household has lead, so I'm just going to come in and take over it. That's why we can't get into the community now, because they see you coming. They see you coming, they lock their doors, they're not home, they hide from it, because they feel exactly that you're going to take them out what they feel so familiar with. When there are some measures you could do, you could inform me that there are some things that I can do that will not ensure but will help or assist in my child not being affected by this kind of invasion into households that are invaded so often. Everyone wants to study the poor because the poor is big business. The poor tell you they don't want you to study them because it might be big business for you, but they're still poor. I'll give you a quote from a woman that said, they told me that the government gave $1 million for a study of 15 families. If they had just divided into the 15 families, they wouldn't have been poor. Now that's an interesting concept, but the poor understand that it's big business, and they don't want you to invade. They do want you to offer them empowerment, which is information, into how you can improve their lives, but not just come in wholeheartedly and say, you got a problem, so everybody's got to move out. Everybody in this section's got to move. We're going to move you to a concentration camp, this little tent. Because they know what that means. A lot of people know what that means in urban areas.
If I could add to that just a little bit, I would echo what Linda's comments are on that. And a lot of what we do as government, we can't invade people's homes to a degree. I think a lot of what we need to do, we strive to do at this point in time, and it looks like we need to enhance those activities through education. Get the point across, such as lead that we're talking about today. Why is it an issue in anyone's home, particularly in a home that was built prior to the 1960s? And you have a large housing stock that has been talked about that would be identified with that. So how can we educate the population as to the importance of lead, particularly with a preschool population, and what you, the homeowner or the landlord, can do to at least minimize the risk? Maybe you can't abate the issue completely, but at least minimize that. So I think a lot of what we have to look at are mechanisms on how we can educate the community to how they can help themselves.
Census information does not go down to the unit.
Census information we can get right off the internet. The density maps that we showed up there, those eventually will be released to the public. One where kids were screened at 201 Westfield, we can't, or I'm told we cannot publish that 7 kids were screened at that particular address, and 5 of them were between 10 and 19.
At that point, it's medical information.
But you cannot, let me be clear, and if someone knows where I can get it, I have not been able to get it, that census information to the block group is available to you. Census information to the household is not available to anyone. That is private. That means you know what my household income is in that house. Block group is available anywhere, but they will not provide for you as far as someone tells me they will, tell me not, you can get it as far as block group. And block group is more than just one block. It is a census block, which includes many blocks, and you can get that information.
Yeah, and I would also add you can get census information from block level, much less so in terms of the number of variables you can get.
Correct.
But also, if there are less, and I forget the exact address, we're talking about blocks, but there are less than so many individuals
On the block, you can't get that.
Release that because again, you might be able to figure out.
Census population down to the block group. Medical information, you have to be more careful about depending on the number of cases we identify.
That are in that block.
Somebody else might be able to determine somebody's identity from that. So it's just a guess.
I think we add to that a little bit as far as you have to recognize where the data, as Kevin has mentioned, has come from is through screening activities. A lot of hard work on many people's parts, agencies' parts, if you will, have gone together to collect that data. And a lot of work has taken place for those specific households that we've referred to here as far as how they can minimize the risk in that particular environment. So a lot is taking place that is not really out there, if you will, that is not as public on an individual basis. Obviously, we need to do a lot more. We have a large housing stock where we do have issues with this. But you get back, as Linda mentioned, this invasive problem that we have to deal with. You know, if we're banging on your door as a local health department that your house has been identified as having a potential lead problem, you know, people are concerned, why are we as government knocking on their door? So you have to look at those ways, and that's why we get back a lot to education on how we can help the public as far as what they could do with their specific situation and the importance of lead.
But you need to think more that lead does not jump up and just because lead is present doesn't mean you're going to get lead poisoning. I lived and was raised in a household, probably why I'm a little dingy, but I didn't die from lead poisoning, okay? I didn't lick the walls while I was there, but I probably had more contact to lead poisoning. You have to understand there are other things that are more devastating in these communities than lead poisoning. So every unit that has lead, a possibility of there being lead, does not mean that there's lead there that will harm the person. We could do some preventative things by telling you how you could prevent your child from getting lead poisoning by doing these kinds of things, rather than to just take a whole housing stock out and say, this has lead here. Because you have to do something, interact with lead. It's just not there. You have to do. And I would say to you, and I would dare to say to you, that if I went to my neighborhood that I work with on the south side, and I told them they had a lead problem, they would say, yeah, and somebody got killed yesterday on the street. Lead, because it doesn't kill someone in the newspaper, does not become a major, yes, they could do some things.
So you saw my notes, because that's what that's a great.
If I can, let me jump in there just real quick. Solution is what we're looking for. And as this group had a chance to convene and have lunch today, one of the things that I was taken with was the notion that as we would target different parts of Muncie, as there's a lead problem in this area, frame it in such a way that, did you know that you have a right to get your blood tested for high levels of lead? And frame it in such a way that's in a positive, that you get to participate, take some ownership in the solution, that this quadrant around Kilgore, as we look back at the map, there's an area around Kilgore, just close proximity to Ontario's system, that has a real high concentration of red dots. Well, I think if we quadrant off that portion of the city and let it be known that from the results of WIC and wherever else they gained their survey, that there is this essence of lead there, and that you have a right to go to the health department. If the health department is equipped to handle that, I don't know that necessarily, but they can go and get a blood test and be a participant in what's going on rather than being dictated to, and ultimately in some cases being displaced. As we would launch into that, though, we need to be thinking about, hey, we are going to displace families. They are going to be out of their home. What are we going to do then? I don't know how much housing needs to be anticipated for such an action, but certainly it has to be considered.
I would make a comment on the basis of being a landlord and owning a two-unit property right in the very neighborhood that Dick is talking about. And I think there is a real need to inform and educate landlords. For us to be without the income of that particular unit would not be devastating to our lifestyle. It would hit us and we'd have to make some changes and so forth. But I can think of some people whose livelihood is being in the rental business. And for them, that's a much bigger issue to look at how to abate the lead in those homes than it would be for us. But we don't know how to do it. I mean, we don't know. And it's unfortunate that the things that I am looking at here, as I've learned about what Kevin is doing, is forcing us to go after some information, but it's not easy to find. And that's tragic that we can't, as landlords, just go out and call one number and know exactly what we're supposed to do. So I think something that would assist landlords would be very valuable.
I think you have to keep in mind that we're talking about two issues here. One is homes that could be, or that could have lead levels in the paint, and homes that are actually hazardous. Any house built before 1950 probably does have some lead paint in it, but it's only the paint that is chipping and peeling that's going to be a hazard to a child, or adult for that matter. So you have to consider basic housekeeping, hand washing, simple things like that that don't cost a lot of money, can reduce the hazard that the lead paint that could be in the house will show towards a child. One of the things we try to do is promote the fact that a house doesn't have to be lead free to be lead safe. A few years ago, there was a big push from the federal government that all houses had to be lead free. Well, it was very apparent soon that you can't spend $20,000 on a rehab on a house that you paid $20,000 for, because it just wasn't feasible and it wasn't worth it. So when they moved to the point that they were trying to make houses lead safe, now we're getting into things where a fresh coat of paint, it may not last 20 years, but it will reduce the hazard, the immediate hazard that child faces. The reason that we focus on children under 6 years of age is because they are the ones who have the most hand-to-mouth activity. Putting their fingers in the lead dust and lead chips and putting their fingers in their mouths. That's the number one way that children get lead poisoned. Very rarely you'll see them actually eating the paint. It's getting it on their fingers and putting their fingers in their mouth. So simple hand washing before eating dinner, washing toys, things like that, making sure you keep them away from areas that have peeling paint, can reduce the hazard of a home, even though the home is built before 1950 and probably does have lead paint.
I would echo Jeff's comments on that as far as it gets back to my earlier comment about education of the population as a whole, specifically the population that might be at risk living in your older housing stock, if you will. To answer your question, sir, about activities that I would like to see as far as the local health department would be to enhance screening opportunities. Most of the screening that takes place is through the Women, Infants, and Children's program, which affects thousands of people on that. but you have a large other population that may not utilize the WIC program and not have that opportunity. They may have a personal physician, they may not, but I would like to see more screening opportunities, then educate that population what they can do, as Jeff mentioned, on how they can minimize their risk without spending a whole lot of money that they do not have, the federal government does not have available, nor the state, nor the local level. Gets back to education.
I guess I look at the issue as threefold. First, it has policy implications. Second, it has physical and structural implications, and then the human implications. I would think first, if we were looking at a policy issue, it would be a consistency in terms of how we treat lead-based cases, children who have lead and have found high levels of lead, and what that would be. To have baseline information that is mandatory to be collected, and some clear follow-up and responsibility that would go hand in hand with the legislation, so that some of the issues and some of the children who suffer from this will not fall between the cracks, because there will be the system that will catch them. The second is the physical structural issues. The physical, I agree with the panelists that said that just because it's a possibility of having lead doesn't mean it has lead. What we need to do is develop a whole campaign for what do you do? How do you prevent your child? What kinds of things could you do as an individual or as a home or a rental person to help minimize the threat of lead poisoning within your unit? I think a lot of people would take that information and be able to utilize it more efficiently and effectively if we had solutions, instead of you have a lead problem and okay, what do you do about it? You got a lead problem, what do I do? The third thing is this human issue, where we have people who are suffering from a multitude of issues that now have to deal with another health threat. And I would think that what we would do for them was to empower them with their own team, a person that they could go to that would be a community health specialist that was like them, that could be access to them when they had these issues, that they could come to and ask, I have this problem, and who would I go through? And that would be community-based and possibly school-based, so that the people will feel more secure that they could go to someone when they had these dynamic issues that are problems to them in their community.
I think there are a lot of opportunities to do that. Certainly in the organization that I work for, there are individuals who are CEOs of large companies. It starts first with education, as the others have said. People can't be concerned about the issue if they don't know about it. And so that gives people such as our group here today the responsibility to make them aware of it. There's a very powerful suit and tie group of folks here in the Muncie community who, when they make up their minds they want to do something, do it very effectively. It was announced just this morning that under the leadership of a number of key business leaders in the community has just raised $7.5 million to build a cancer center at the hospital. And that was clearly something that became the vision of a core of business leaders, and I totally agree with you. I think that's absolutely right. I think in the past there's probably been sometimes siloing of information, if you will. I'm a social service person over here, and this is my problem, and these are my issues. And I'm a business person over here, and these are my issues. And there hasn't been enough communication, but we're living in a more collaborative society when people are finding how much more they can accomplish when they work together. And it's very exciting to see dialogue beginning and walls breaking down, because that's really how issues like this one can be addressed. It takes everybody. If you know.
Okay. We get into housing, as far as we through a local health department, we do have the legal authority, if you will, that we can condemn a house that is unfit for human habitation. There's different criteria that you utilize for that purpose, such as a lack of water supply, obviously, no sewage disposal. You have a severe rodent insect infestation. It could be a multitude of different things that make that environment unsuitable for living conditions. When you get into structural defects, then a lot of that we work with the local building inspector as far as the structural issues. But as far as we've talked about, I think today, as far as the magnitude of the housing stock that we have quite a problem on our hands as far as suitable housing. Some of this, I think, I keep mentioning about education, though, but also we make decisions when we rent a particular house or an apartment. The landlord has the ultimate responsibility to provide a safe environment for that tenant, but also the tenant needs to look at, is this something that I want to rent? You know, when they acquire the property, and did you sign a lease? And if you did sign a lease, what does the lease hold you accountable for? We get involved in a lot of those activities. We always ask, do you have a lease? And no, I don't have a lease. Then who's supposed to take care of what problem? Is it the landlord or the tenant? And it gets back to a dispute between the two, and that's where the legal system comes in, which gets, as we well know, expensive for one and all. But there again, to answer your question, we do. We receive quite a number of housing complaints that we do investigate. We do utilize the courts as far as enforcement of those activities. We've had a pretty good success rate with that as far as cases in court if it goes to that point. But you get in like what we're talking about today on lead, I'm not aware of specific regulations that would encompass our, meaning local health department, declaring this place as unfit for habitation, human habitation, based on, say, if lead was the sole issue. As Linda has mentioned, typically we find a multitude of problems that you'll have in that type of housing stock, in addition to lead. Well, what we do is referrals that we, you get into that, but also get into ownership too. And we get quite a number of referrals from private physicians and the WIC programs I mentioned, and screening that we do as well. Then we work with the tenant, the landlord, we go into the house to identify where the risk factors are in that house or that apartment. Then we work with the landlord or the tenant, preferably both, as far as how they can minimize the risk. When you get into actual abatement, as Jeff has mentioned, a lot of things you can do to minimize the risk, and that's the focus of this time. We will not declare the house as unfit for human habitation based on that because of the lack of regulations that encompass us to do so. The emphasis would be on your preschool population.
That's right, dude.
As long as you do the scraping and painting using spray bottles or keeping it wet so you're not stirring up the dust, you're not going to be causing as great a hazard as scraping it dry. Depends, are you using a heat gun? I would, if it's lead paint, I would not use a heat gun because you will cause more of a problem to the people in the home from the fumes of the paint gun than from the lead fumes. I don't know those. Sure.
There's a theory in adults that has to do with free radical, and free radical damage is believed to be the root cause for a lot of progressive diseases like Alzheimer's, rheumatoid arthritis, and so as you would ingest that as an adult, there's been writings to that extent that your incidence of being susceptible to, like Alzheimer's for one example, or rheumatoid arthritis, would be greatly increased. So, as this gentleman says down here, from my readings, I wouldn't be doing what you're doing. I think you're subjecting yourself to a huge risk unnecessarily. Well, I don't know if you have access to the internet, but HUD, if you